Just because you live rurally doesn't mean you shouldn't have access to excellent healthcare, and that's what we provide. So my name is Tatiana Lowe. I'm an emergency physician, otherwise known as a FACEM, and I'm the medical director of my emergency doctor. We're a virtual telehealth company. We provide telehealth services to mostly rural and remote Australia, but certainly we have metro clients as well. Patient experience staying locally, obviously people want to stay where they know, they want to stay where their families can visit them, and they want to stay where they feel comfortable. But to do that, you need senior decision makers to be able to treat them and work with the staff to come up with the best plan.
My name's Tiffany Cover and I'm a Senior Medical Officer working here at the Dalby Hospital. So we're probably one of the bigger rural hospitals within the Darling Downs. The Dalby population is roughly between 12 to 15,000. Like all rural sites within Queensland, we have significant issues around staffing because of the widespread doctor shortage, but also because we're often already running on quite skinny rostering. As soon as there's illnesses within our staff, you really feel it throughout the whole organisation.
Dalby's part of a broader healthcare setup, and we generally will support them with their rosters. Doctors that will be available at any time, 3 a.m, doesn't matter, we're available to help.
So my emergency doctor has been a service that we've started using within Dalby and within the western cluster of the Darling Downs. Functions 100% as if a doctor is physically in the building, but does it all via the computer system. And it has really helped fill that gap when we're running quite short on staff. It has a huge knock-on effect as well for the larger tertiary hospitals, which have significant ramping and bed waiting issues, and how essential it is to really try and minimise unnecessary transfer and to keep people locally. And it's left that bed available for someone else who desperately needs it in that tertiary hospital.
So we are really happy with our software platform. We use a platform called MediRecords, and they really allow us to work remotely from anywhere. Basically, being the cloud-based software that we use has just allowed us to be so versatile in our ability to service hospitals and clients from anywhere, and also provide that 24-hour follow-the-sun model. We have doctors that work from overseas, from every state in Australia, and we've had doctors working on a boat. We employ GPs, emergency physicians, specialist consultants, cardiology, geriatrics. So we need a software platform that is flexible across specialties. MediRecords really pulls it all together for us. I think importantly these days, everyone's very anxious about data security. We obviously work with a lot of patient data. It's really important to us that we feel comfortable that our software is all over the security aspect, which they are. We need MediRecords to be able to talk to other systems that we use, and we found that works really seamlessly. We have immediate access to My Health Record, which is the national database which we can upload all our records to, which gives us that continuity of care across between us and any face-to-face doctor that the patient may next encounter along their healthcare journey.
My emergency doctor does have a role in staff retention because we know that one of the biggest concerns from rural generalists is fatigue. So I'm a doctor, I'm a mum, I'm an educator, and trying to balance all of that and then doing fatiguing on calls, my emergency doctor can help me to know that things are going to be under control, and if I'm getting called, it's because it's time for me to put my boots on and come to work.
It is so essential in 2025 that we have quality virtual care available for patients and staff in remote communities.